All right, Craig, we'll be back. Then comes flight 1's on scene. I'm up. Roger. Alright guys, unable to secure the cabin. Almost there. O2 is off. Roger, thanks. Come out the flat. Roger. Okay, cabin secure. Left door is open. Alright, 1643, pre-pickup complete. Roger, trees in sight, and you're clear back and left. Yep. Decision. Check. Left door secure. Right turn. Decision. Check. Off our scene, 3 crew, 1 hour and 40 fuel within Echo category, pediatric, male trauma patient, standby for ETA. Left turn. Clear on left.
Just 2 1.
Okay, that is clear. Road, checking out.
Temperature 2 Temperature 3004. Arrival respect visual approach runway 35 right, 35 left. Simultaneous approach is view. Arm approach is available upon request. Note to airmen. Runway 35 left, sequence flashing lights on the surface. Position approach fantastic on runway 35 left on the surface. VFR departure contact clear to lift. 25 have information, Charlie.
Every time those rotor blades turn, I feel powerful. It's like a drug, like my adrenaline and cortisol are somehow powered by the inertia of that machine. As those rotor blades turn like clockwork, my mantra begins. You've got this. You've got this. Slow, purposeful combat breathing. I pat down the equipment in my vest. I know everything's there. It's part of a mental preparedness checklist. It allows keen focus on the next task. And a keen focus is required because in my job, a bad decision can be fatal. Not just for a patient, but to me and to my crew. So if the stakes are that high, then why do it? And I don't have a good answer. It's possible that I've always loved adventure. Even as a kid, Greek mythology triumphed over more age-appropriate literature. Love and power, conquest and adventure. And as an adult, this still remains appealing. We can identify with this. In the ancient Greek myth of Jason and the Argonauts, Jason, who was the rightful king, was denied his throne until he returned with the ram for the golden fleece. Jason enlisted an infamous team to include characters like Hercules and Theseus. Their vessel, the Argo, was faced with overwhelming adversity. Their travel was a challenge, and the people they met along the way, inspiring, enchanting, and dangerous. And despite this, Jason pushed forward because his quest was meaningful. The golden fleece, his golden fleece, represented everything he was and all that he could become. And isn't this us? In emergency medicine and critical care, aren't we all in constant pursuit of our golden fleece? The discovery, the mastery, the quest to be the best, to make life better, this psychological drive, this need to achieve, the personality type that defines us. This is what stories are made of. It certainly is what my story is made of. Because let's face it, none of us are here for the money or for the glory, because those things are virtually non-existent. We are here because this matters. This, what we do, our passion, our commitment, our altruism is our golden fleece. Trouble is, though, out there, the game changes. Last fall, I landed in a pasture in rural Texas to the scene of a pediatric cardiac arrest. Tall grasses obstructed the views ahead. Perhaps it's the military in me that made me hyper-vigilant. Or maybe it's the mom in me. But I notice it all. Not just a pediatric arrest in progress or the all-terrain vehicle that had flipped over on him. There were middle-aged ranchers in their boots, faces in disarray. A sister, hysterical in the periphery. The horror in the faces of first responders, looking for us to swoop in and save the day. Thank God you're here, is always muttered. I captured that scene in a matter of moments in the fine details. The jewelry on the mother's hands grasping onto his little feet, the ants that found their way to his little toes. All those images stay in my mind forever, and all the while stories are being told, answers to what happened. How long was he under the ATV? How long has CPR been in progress? My words all landing purposefully and calmly. And normally I would use these words to make sense of a situation. But if on this case, on this day, I heard bits and pieces of sentences. Conflicting reports of times, first 15 minutes, then 60 minutes. There was a ground paramedic. It was his first day on the job, wide-eyed, saying, I don't know what to do. Concerns about protocols, words like call it. The calm and collected voice of my partner choreographing a chaotic scene. On this day, with this little boy, I was not a nurse. I was not a rescuer. I was not a tough and seasoned clinician. I was a mom. Because at home, I have my own little blue-eyed, sun-kissed, tan, daredevil of a child. On this day, muscle memory dictated the moments and the interventions. Establish airway, bilateral IOs, blood, go. And that's exactly what happened. And CPR continued in the aircraft. But you see, our proficiency is a curse. Because when you have trained and planned and done everything quickly, there leaves a quiet. Nothing to do but attempt with every compression to force life back into that child. And in those moments, the world comes to a standstill. At 150 knots, a controlled resuscitation lets in the calm and the time to consider what now? Have we done everything? What's our next move? A series of glances and nods between partners who can anticipate each other's next thought. Pulse check. We've got a pulse. And where joy should be, a knowing conscience exists. What have you done? You selfish egomaniac, Ashley. Do you think you're God? This child doesn't have a chance. And you've prolonged this experience and you've made it worse for them. They'll have to withdraw care. What if he lives in a vegetative state? Jesus, Ashley, what have you done? And with this mantra in mind, we land at a pediatric trauma center. Trauma bay filled with eyes and hands waiting. Report given. I could hear the words coming out of my mouth in the same cadence and fashion as I have handed off trauma patients hundreds of times. But only this time, I felt the judgment of the voices asking, annoyed, for the third time, "How long did you say he was down?" And my response elicited an eye roll and a sigh, and I wanted to scream. I wanted to shake someone and say, what if this was your boy? What if you were the one on scene making decisions with little resources and conflicting stories? Does it change the outcome? Or is it just designed to make me feel small, that you are superior, that you would have done it differently, that you would have done it better, that I have inconvenienced you by landing here, that there are a dozen of you in a controlled environment and 2 of us in a goddamn field? But I remained silent. I maintained composure and professionalism because the boy's mother is right there. I gathered paperwork and tried to avoid eye contact with her. I fled to the nearest bathroom. I stood dry heaving over a toilet, sobbing as if I was performing some sort of exorcism of guilt. And to hear this story, the decision was right. And it doesn't matter that it was a benign case to you, and you can nod your head that you would have done the same. Completely logical, and I have made something out of nothing. But right or wrong doesn't matter. What matters is that flight nurse, war veteran, pretty much all-around badass, fell apart. I stood in the hallway waiting for a physician to come back from a CT scan, to which I already knew the answer. He's herniating. He'll die in 24 hours. And he did. And I flew out the next morning to the other side of the country to give a lecture. I compartmentalized. I refocused. I put on my game face. Until 2 weeks later, when my short attention span, fatigue, and short temper was noticed by my family. The same woman who stood at SMACC last year and gave a talk about recognizing post-traumatic stress was unraveling. I didn't see it coming. I didn't realize it was happening while it was happening. There was no indication and there was no warning. And everyone around me was just functioning the same, and I was in shambles. And I'm not here for your sympathy, because the soldier in me wishes we could solve all the problems by suck it up and drive on. But that attitude is irresponsible, because the reality is that despite the eye rollers and naysayers amongst you, the success in your career and personal life involve your ability to respect that we have a difficult job. In pre-hospital, in emergency medicine, in critical care, your mental health and physical health pay a toll. And this isn't new news. You've likely heard about it at a human resources orientation, or you've swiped past articles online. You know that there is chronic stress in our job and that there's a high rate of suicide among clinicians. And maybe you've never taken the time because it doesn't apply to you, and you're fine. You know all the tools and are very capable of managing. And if this is the case for you, I am truly happy. But the reality is, for some of your colleagues, maybe the one sitting next to you, for sure the one standing in front of you, we are somehow genetically less capable of manifesting your level of neuroendocrine superiority. As my colleague, as my teammate, as my peer and my friend, I need you to be nice. The U.S. Surgeon General said in a speech last month, compassion is one of the most potent medicines we have at our disposal. And I would agree, but I don't think that this just applies to our patients. I think it applies to each other. And for me, this means understand me, communicate with me, respect me. Understand that under stress, our hypothalamus and pituitary secrete hormone, which stimulates the secretion of hormone of cortisol from the adrenal cortex. It's our HPA axis. It's the connection between our central nervous system and our hormonal system. And in chronic stress, it is in persistent overdrive, a negative feedback loop that fails to inhibit the release of cortisol. So in my case, just there, the useful fight or flight cortisol that should have just played a role in that short-term adaptive response to accomplish the task never had an end point or a physical release because I ran away. Despite knowing better, I didn't diffuse the situation. I didn't debrief what was to me clearly a critical incident. It wasn't a critical incident to anyone else. It was a normal day. Trauma is what we do. It's always sad to lose a pediatric patient, but it's not rare. In my community, they only call a helicopter unless it's the worst case scenario. So due to the frequent nature, it didn't make sense to anyone else that this was a difficult case for me. And to be honest, it didn't make sense to me either. So now I had all of this hormone surging through my bloodstream, and I couldn't sleep. So you know what sleep deprivation does to your cortisol levels? It jacks it up there a little bit. So now I'm drinking coffee because the rest of the world can't wait for me to get my shit together. Caffeine, more cortisol. So this becomes a cycle over the period of several months, where the cortisol stimulation of my amygdala, I became focused, actually fixated on the event that caused the initial stress response. My prefrontal cortex, the part that's normally responsible for critical thinking and rational thought, has been hijacked. Now I'm only capable of lower functioning, short temper, knee-jerk reactions, emotional, difficulty with attention and memory. The elevated and extended release of cortisol in chronic stress causes long-term effects. Cardiovascular disease, thwarted immune system. Neurons in the hippocampus actually begin to atrophy. And this is where the good stuff happens, like creativity and learning. And my synapses in my prefrontal cortex were disintegrating. In a response to experiencing and caring for people's worst nightmares on a daily basis, some of us suffer. Stress and chronic stress isn't a weakness or a choice or a personal flaw. It's a physiologic response requiring adaptation and self-awareness. Understanding this, I spent the last several months changing behaviors. I took up yoga. I was delighted this week to hear Scott talk about meditation because it has been a life changer. I educated myself on the effects of chronic stress and figured out ways to decrease cortisol levels. Exercise, laughter, and human touch. I talked with my family about what I needed. I need time when I get home to decompress. Don't bombard me with questions to further exacerbate the already present decision fatigue. For 1 hour, we don't talk about the things that mommy needs to do. I talk with my colleagues. I have and continue to have honest conversations. Despite the t-shirt, turns out I don't have superpowers. After each flight and an after-action review, I need to be comfortable to say, I was scared. I'm sad. That was awful. And if it wasn't for me, I need to be aware that it might have been for someone else. Or maybe everyone's fine. And there's no shame in that either. But either way, I strive to be helpful and non-judgmental and understanding. Sure, I put my foot in my mouth sometimes. I say something callous. I'm not perfect, but I'm quick to apologize and self-reflect. So if you haven't figured it out yet, the golden rule is just that. Do unto others as you would have them do unto you. This isn't just a commandment of ethical reciprocity from the beginning of time. There's a fair amount of research to back it up. I believe Peter Brindley will be talking about this afternoon. Rude behavior among your team has devastating outcomes. Poor behavior affects the ability to perform procedures and diagnose. It immediately ends the functional communication within a team. Respect that my reactions to my environment or incident will be different than yours. And it doesn't make one of us right or wrong, it makes us different. Our genetics, our physiology, our experience determines our response to stress. We can prepare and simulate and inoculate and train to develop resilience and healthy coping strategies, but our experiences will never mirror one another. When I was writing this talk, I wondered if the physician, in the case that I described, knew that this was the case that could have ended my career. I was so convinced that I had failed this family, that my motherly instincts got in the way of my clinical decisions. I confessed to the doctor that I was in such a vulnerable state that his response could have been the straw that broke the camel's back. He became tearful. He stood up, gave me a hug, and said, "Man, I'm glad I wasn't a dick." I hope that when you return home, to your shop and to your team, that you will all continue your quest for your greatness. That on this adventure for your personal golden fleece, that you will be mindful of the people around you. They are no doubt giving their best in the heat and the chaos of the golden hour. Your team, your very own Hercules and Theseus and Medea, they'll define your journey. And your adventures with them may very well define your place in history. Thank you.
Thank you, Ashley. I'm sure that everyone here has already passed through something similar, and listen to you will certainly help us in our next time. Sarah, we have a few minutes.
Yeah, lots of comments about, people really happy you're talking about issues about stress and how this happens to everybody. If you see somebody behaving poorly or perhaps unkindly at work or in a team, do you have tips on how we can redirect them or feed back to them to perhaps more inclusive behavior?
So the resident that thought it wise to question our decision, I did talk to him afterwards, and just I think a lot of the times that we come from an environment of that we're unaware. Most people don't understand the pre-hospital environment and the challenges presented there. Most critical care docs may not understand the challenges presented in the emergency room and vice versa. So we spend a lot of time being in judgment and feeling superior to one another, that we would have done it better. And I think that if we can have those conversations of awareness about where we are and the challenges that are presented, and always be mindful and respectful of one another.
Thank you.